Good morning, students. Today's topic of LCT is on radius. So, radius it is the bone of lateral bone of the forearm. It is homologous with the tibia of lower limb. Okay. So, like the other long bone, it has upper end, shaft, and the lower end. How will you determine the site? Determine that is the head is disc like while the lower end is expanded to form one process, that is the styloid process, and the medial border is the sharpest border, and on the posterior surface of lower end of radius there is the dorsal tubercle of Lister. So features like other long bone, it has upper end, shaft, and the lower end. So upper end of radius, it is consist of the head, neck, and the radial tuberosity. The head is articular and on superior surface it is a concave, and the superior surface articulates with the capitulum of radius to form humeroradial part of elbow joint. So elbow joint it consists of the two part, that is humeroradial part and humeroulnar part. So superior surface of head of radius is concave, articulates with the capitulum to form the part of humeroradial part of elbow joint. Then the peripheral margin, this is the peripheral margin of head of the radius. On the medial aspect it articulates with ulna, it articulates with ulna to form the superior radio-ulnar joint, while the rest of this head it is covered by annular ligament. Okay, then this constricted part, it is a neck of radius that succeeds the head, and it is encircled by the lower part of the annular ligament. The latter is separated by a sinual protrusion of superior radio-ulnar joint, which is supported by quadrate ligament. Then this is the radial tuberosity. It is present on the medial side of the lower part of neck. Posterior part of tuberosity is roughed, and it receives insertion of tendon of biceps brachii, while anterior surface part it receives bursa. Okay, bursa. So this the tendon of biceps brachii is twisted manner. Its anterior part is smooth and separated from the bicep tendon by bursa for supination of the forearm. Then the lower end of this radial tuberosity gives attachment to this oblique cord. Now moving towards the shaft of the radius. So this is the shaft of the radius. This shaft of the radius, it consists of the anterior border. This is anterior border, this is medial border in the posterior border. So this anterior border is oblique in the you can see it is oblique in the upper part, sloping downward laterally from the lower part of radial tuberosity. The lower part is vertical, and extend as a prominent ridge in the distal fourth of the shaft, where okay, and it is continuous with this anterior border of styloid process of lower end of radius. So this is the anterior border, and this is the anterior oblique line. So this is anterior oblique line. This oblique part is also called as anterior oblique line. Another is medial border. So this is the medial border. Interosseous membrane is attached, so that's why it's called as a medial or interosseous border. It is the sharpest border among all the border. If you feel all the borders of radius, you can feel the sharpest border. It is a medial border. So you have to keep in mind interosseous borders are the sharpest border. So this is sharp and it extend little below this radial tuberosity, okay, up to this the lower end of the radius. Okay, so this is the medial border. Then the posterior border. So this is the posterior border. This posterior border is well defined only in the middle of the shaft, while the ill defined in upper part and the lower part of radius, and it is a mirror image of this anterior border, and this is the oblique posterior oblique part of this posterior border. Then the surface is anterior surface. Anterior surface, it is a present between anterior border. So this is the anterior border and this is the medial border. So this is the anterior surface. So this is the anterior surface. Lateral surface present between this anterior border and the posterior border. So this side surface is a lateral surface, while the posterior surface, it is present between the medial border and the posterior border. So this is the posterior surface and this one is the lateral surface. Coming towards this lower end of radius, the lower end of radius, it is an expanded and widest of this bore. So it has again it has a five surfaces. This is the anterior surface, medial surface, this one is lateral surface, and this is posterior, and this is the inferior surface. The anterior surface is represent the thick prominent ridge which is palpable through the overlying tendon. So pulsation of radial artery, it is filled against this distal part, okay, this surface distal to the pronator quadratus muscle is this. Okay, so this is the anterior surface. This one is a posterior surface. So on posterior surface there is a tubercle called as a dorsal tubercle of Leicester that divide into the various longitudinal grooves are there. So here there are the longitudinal grooves are there. Okay, on inferior aspect there is the lateral part there is a triangular area that is articulates with the scaphoid bone, and quadrangular area it articulates with the lunate bone. On this diagram you can see also this is the radius bone, this anterior surface, lateral surface, posterior, this is the posterior surface, this one is the medial surface, and this one is the inferior surface. Now moving towards his attachment. On the attachment, this is the anterior surface view, this is the posterior surface view. On the anterior surface, okay, you can see on the lateral surface of the neck of radius gives insertion to supinator muscle. This is the radial tuberosity. So anterior surface is covered with the bursa, while the posterior surface gives insertion to the biceps brachii muscle. Below this radial tuberosity, it gives attachment to this oblique cord. This anterior oblique line, it gives origin to the flexor digitorum superficialis muscle. Then the lateral surface of the middle of the shaft gives insertion to the pronator teres muscle. The anterior surface of the middle of the shaft of radius gives origin to the muscle that is the flexor pollicis longus. So this is the flexor pollicis longus. Lower one third of the shaft of radius, its anterior surfaces gives origin insertion to the pronator quadratus. So pronator quadratus origin from the ulna and insert on this radius bone. Just above the styloid process of radius, there is insertion of brachioradialis muscle. and this is the capsular line attachment. Then on the posterior aspect, again you can see this is the insertion of bicep brachii muscle, then supinator muscle. Posterior surface of both ulna and radius, one muscle origin, that is abductor pollicis longus muscle, and from the posterior surface of radius, extensor pollicis brevis muscle. Okay, so from the posterior surface of radius, two muscle origin, that is abductor pollicis longus and extensor pollicis brevis muscle. Okay, while this abductor pollicis longus muscle origin from the both posterior surface of ulna and radius bone. Now moving towards the attachment on the lower end. So as I have already told that the dorsal tubercle of Lister is there, so it is related with the various tendon, and due to this it shows various compartment. Okay, so this is the dorsal tubercle of Lister. So the lateral part of dorsal tubercle of Lister, it lodges the two tendon, that is the extensor carpi radialis longus and extensor carpi radialis brevis tendon on the lateral side. Okay, on the medial side of this dorsal tubercle of Lister, there is extensor pollicis longus tendon, and just medial to it extensor digitorum tendon along with the extensor indicis tendon. Okay, on the lateral surface, it gives related with the abductor pollicis tendon and extensor pollicis brevis muscle tendon. Okay, while in between the radius and ulna, there is the extensor digiti minimi tendon. Okay, so these are the attachments on this part of the lower end of the radius is related with the following muscles. Okay, tendon of the following muscle. Now coming towards this ossification of radius. So radius is ossified from one primary center, that is appear at the 8th week of intrauterine life. Secondary center for upper end appears at the age of 4 years, fuses with the shaft at the age of 18 years, while the lower end appear at the age of first year and fuses with the shaft at the age of 20 years. Now clinical anatomy, we will going to see this following things. Okay, first is a Colles fracture. So what is a Colles fracture? It is a fracture of the distal forearm in which the broken ends of radius is bent backward. It occurs when a patient fall on outstretched hand. Okay, so if patient fall on outstretched hand, Colles fracture occur. If the patient fall on inward hand, then the Smith fracture will occur. Okay, so when patient fall on outstretched hand, there is the Colles fracture. Okay, if this fracture is not treated properly, then the malunited distal part of the radius, due to malunited, they develop one deformity. It is called as a Diener fork deformity. So if this Colles fracture is not united properly, it develops a Diener fork deformity. Then next is the Smith fracture. Is a fracture of the distal part of radius, occurred when the direct flow blow to the dorsal forearm or falling into the flexed wrist. And the Smith fractures are less common than the Colles fracture, and in this distal fragment of radius moves ventrally, while in Colles fracture distal fragment moves backward. Then the pull elbow, it is a sudden powerful jerk of a hand may lodges the head of the radius from the grip of annular ligament. This is known as a subluxation of the head of the radius, that is a pulled elbow. Okay, so the head can be normally, okay, so this is the pulled elbow. I have posted demonstration on radius bone, so you have to go through that video also. Thank you.